Welcome to another psychology review video. In today's video, we're going to cover 50 high-yield psychology medication questions. These are the questions you will likely encounter during your exam, so this is going to be a great video to listen to while on your ride to the school, while working out, or anything like that, because it's a fast-paced, high-yield video. So let's begin. The first question is, what is the first-line medication class for major depressive disorder? And that would be the SSRIs, such as fluoxetine, sertraline, increased serotonin by blocking its reuptake. So common side effects of the SSRIs are going to be sexual dysfunction, GI upset, and sleep changes. So the memory hook that I have for SSRIs and MDD is hop on the searcher flow train. So sertraline and fluoxetine lift the mood. So if I think of major depressive disorder, I think of SSRI as a first-line treatment, and I just think if I'm depressed, I need to hop on the searcher flow train to the happy town. Question number 2. What is the black box warning for all antidepressants? One tip I can give you during your PA school, anything that has to do with the black box warning will likely be tested. So if you see that on your slides in school, write it down, underline it, highlight it, what you got to do just to remember that because you will see it on your test exam. So the answer is, when it comes to the SSRIs and antidepressants, the black box warning is suicidal thoughts in patients under 25, because they're going to feel that increased energy that they didn't have for a while. So if they thought about committing suicide, that would be the time they'll likely do it, especially early treatment, first 4 weeks. Number 3. Which SSRI has the longest half-life and the lowest withdrawal risks? So the question stem can list 4 different SSRIs and ask you which one of these has the longest half-life and the lowest withdrawal risk, and the answer is fluoxetine, Prozac. So it has a long half-life which allows for smoother tapering. And the way I remember this is that fluoxetine flows long and steady. Fluoxetine flows long and steady. Which SSRI is safest during pregnancy? That would be sertraline, Zoloft. It is preferred for pregnant and breastfeeding patients. And the way I remember this, I would just say sertraline keeps mama safe. Sertraline keeps mama safe is the safest during pregnancy. Number 5. What serious condition can occur if SSRI are combined with MAOIs? And that would be the serotonin syndrome. And the triad of serotonin syndrome would be hyperthermia, hyperreflexia, and agitation. So SSRI plus MAOIs equals serotonin syndrome. Question number 6. Which SNRI treats both depression and neuropathic pain? Which of these medications has a dual effect? And that would be duloxetine. Cymbalta. So it blocks reuptake of serotonin and norepinephrine. And the memory hook is duloxetine, duals, pain, and depression. Dual, you need 2, pain and depression. Or you can think duloxetine as duo, in which case we're dealing with depression and neuropathic pain. So the question stem asks which of this medication can treat both. Think dual, duloxetine. Which SNRI can cause hypertension? And that will be venlafaxine, Effexor. Dose-dependent blood pressure increase. And the memory hook that I used is when pressure rises with venlafaxine. Another way that I would remember this is I would ask myself if the question stem is asking me of the following medications that a patient is taking, presenting with hypertension, which one of these medications side effects likely to cause, and that would be the venlafaxine. Which antidepressant avoids sexual side effects? And that would be Wellbutrin, bupropion, dopamine norepinephrine reuptake inhibitor. And the way I remember this, I would just say bump your mood, not your sex life. Bump, bump, bump. From bupropion, bump, or well sex with this medication. So it is not causing any sexual side effects. So the question stem could ask you something like, this is a young patient that is depressed, needing antidepressant, and which of these medication would have the least side effects? And that would be Wellbutrin. Which antidepressant causes weight gain and helps insomnia? And that would be the Remeron, mirtazapine, sedating and increases appetite. So memory hook is REM in Remeron, indicates REM sleep. REM-RON, sleep. REM in REM-RON increases REM sleep. The questions then could be asking you, of all the following medication, which one would you prescribe for this depressed patient that's also dealing with a lot of insomnia? And that would be mirtazapine. Question number 10. Which antidepressant is contraindicated in eating and seizure disorders? And that would be Wellbutrin again, because the Wellbutrin's major side effect is that it lowers seizure threshold. So if you question them says this is an alcoholic patient that it's admitted and is potentially increased risk for seizure, which of the medication should be stopped? And that would be Wellbutrin because it lowers the seizure threshold. Number 11. What is the mechanism of tricyclic antidepressants? Mechanism of action. And that would be the block reuptake of serotonin and norepinephrine. What TCA is most cardiotoxic in overdose? And that would be amitriptyline. It can cause arrhythmias and a wide QRS. And the way I remember this, I would just say the girl named Amy. Amy trips the heart's rhythm. Every time I see Amy, my heart races faster. You love Amy. Amy is just super cute and she just makes your rhythm go up. So anything to do with the cardiac stuff, cardiotoxic in overdose, I would take amitriptyline. What foods must be avoided with MAOIs? And the way I would remember this is the tyramine-rich foods such as aged cheese, wine, cured meats. God, that's pretty much like 80% of my diet. Uh, so MAOIs would not be good for me. So tyramine-rich foods, MAOIs do not go together. What is the first-line mood stabilizer for bipolar disorder? And that would be lithium. So reduces mania and suicide risk. So if patient presents with bipolar 1 disorder and they ask you what's the first line medication treatment, you should be thinking lithium. Memory hook is I know the bipolar gonna present with manic episode that has to last greater than 7 days, which is 1 week. So 1 bipolar week and it gets charged with lithium. Also in bipolar, you're gonna see people with their highs, and I would just say my week is flipping back and forth and it's like a bipolar battery and only lithium charges are right. What are signs of lithium toxicity? This is a commonly asked questions on the boards and it will be early tremors and nausea and later you're going to see confusion and seizure. So lithium side effects, let's go over them in real detail. So lithium side effects, just remember the mnemonic lithium. Lethargy, increased urination, tremors, hypothyroidism, impaired cognition, urinary retention, and metallic taste. You're going to have a GI upset, dry mouth, weight gain, kidney damage, and seizure. And also, they may ask questions about lithium toxicity. So, they're going to have a narrow therapeutic index. A normal lithium level should be between 0.6 and 1.2. So, if you see the narrow therapeutic index of lithium is greater than 1.5, that should make you think of lithium toxicity alert. So, lithium side effects, remember mnemonic lithium, lethargy, increased urination, tremors, hypothyroidism. That is another really commonly tested question. They're going to list all different presentations, all different findings, and one of them is going to be hypothyroidism. And they're going to ask you which of the following medication could likely contribute to this, and your answer will be lithium. So this all you will find in the PA Study Buddy ER book, in which you will see 120 style ER questions that cover 57 topics from the blueprint, as well as detailed coverage of every content of the blueprint. So let's continue. 16. What birth defect is linked to lithium? And that would be the Epstein anomaly, tricuspid valve defect. And memory hook I have is a baby Epstein rise lithium vape. So they can go several different ways in the question set regarding this. They can list 4 different heart findings, and one of them being tricuspid valve defect, and ask which one of these is a link to the lithium, skipping Epstein anomaly, skipping the mother taking the medications, just asking the about tricuspid valve defect, or they can ask patient was present with the Epstein anomaly during the birth, and which of the following medication is likely the culprit? That would be again lithium. What mood stabilizer is best for rapid cycling bipolar disorder? Rapid cycling be the key finding in this question, and that will be valproate. Depakote increases GABA levels. So rapid cycling bipolar disorder, valproate treats it right. What are the key risks of valproate? Well, that will be hepatotoxicity. It's really harsh on the liver, pancreatitis, and neural tube defect. So they could also ask you, a mother presents to the ER with her baby, and you find the baby has, neural tube defect, and they're going to ask you which of the following medication was mother likely taking during her pregnancy and that caused the neural tube defect, and that will be valproate. Or they can say patient presents with pancreatitis or hepatotoxicity. They're going to list 4 different medications and ask you which one of these is likely the culprit, and that would be valproate once again. So it is important for you to realize that with every question that they ask, you should be looking at the last sentence and asking yourself, okay, what are they asking me in this stem? Look at the answers and then read the entire stem. So, which mood stabilizer can cause Steven Johnson syndrome? And that will be lamotrigine, especially with fast titrating. LAM in lamotrigine, LAM lights up mood and skin. So in a question stem, they could have a patient that presents with Stevens-Johnson syndrome. They're going to list different medications, and a side effect of lamotrigine can cause Stevens-Johnson syndrome. Which antipsychotic causes agranulocytosis? Clozapine requires white blood count monitoring, and clozapine closes your YBC count. So you're going to have a patient that has granulocytosis, and they're going to ask you which medication likely caused this. It is clozapine. Or they're going to say you are thinking about prescribing clozapine to this patient, and which lab should you be monitoring? And that would be the white blood count. Or they're going to ask you which of the following side effects is most likely to be caused by clozapine, and that would be a granulocytosis. Which antipsychotic causes the most weight gain? And that would be olanzapine, high metabolic risk. Olanzapine expands your waistline. Olanzapine expands your waistline. This is the antipsychotic that causes the most weight gain. Which antipsychotic prolongs QT the most? And that would be ziprasidone. Gideon. May cause torsade de pointes. Zip your heart rhythm tight. Zip in the ziprasin. Zip your heart rhythm tight. Or they're going to ask about prolonged QT. You're going to look for that zip in the answers, and you'll always get that right. Which atypical antipsychotic treats bipolar depression? Which atypical antipsychotic treats bipolar depression? That would be quetiapine. Seroquel is also very, very sedating. So the memory hook is quiet the storm with quetiapine. Quetiapine, sedating, treats bipolar disorder. What is the neuroleptic malignant syndrome, NMS? It is rigidity, fever, and elevated CK due to the dopamine blockade. Which antipsychotic causes extrapyramidal symptoms? EPS. That would be the first generation typical antipsychotics like haloperidol. And this one was one of the easiest one for me to remember. So I think of extrapyramidal symptoms. I think pyramids, and I'll just say hello pyramids. What is used for acute agitation in schizophrenia? So they're going to present a patient that has a schizophrenia that is acutely agitated, and they're going to ask you what's the best treatment, and the answer is haloperidol intramuscular IM. It is fast-acting dopamine blocker. Halidol howls down hostility. Halidol howls down hostility. Haloperidol IM treats acute agitation in schizophrenia. What are the 4 EPS types and treatments? Dystonia, treat with benzotropine. akathisia with beta blockers, Parkinsonism with benzotropine, and tardiva dyskinesia with clozapine. Another question they could ask here is they're going to list 4 different presentations. They're going to ask you which one of these 4 is not part of the EPS, and that would be the one that is not present here. And the memory hook is DAPT, dystonia, akathisia, Parkinson's, tardive. What is the benzodiazepine mechanism of action? Enhance GABA A, which will increase the chloride influx, which will cause the CNS inhibition. Benzodiazepine mechanism of action, GABA A. What reverses benzodiazepine overdose? That would be flumazenil, GABA receptor antagonist. And I would just say flumazenil, find your way out of the benzo maze. How do I find my way out of the benzo maze? Well, flumazenil. What non-sedating anxiolytic has no abuse potential? And that would be busbar, serotonin agonist. Buspirone, busbar, non-sedating anxiolytic with no abuse potential. What is the first line medication for generalized anxiety disorder, GAD? And that would be SSRI, such as escitalopram or venlafaxine. What medication reduces PTSD nightmares? I've seen this question several times through my PA school. I've been asked this on my rotations. I rotated through the VA rotation, and I've seen this a lot. So it is prazosin, alpha 1 blocker, pra. In prazosin, I just think pra or pro, and I would just say sleep like a pro. Sleep like a pro. So for my PTSD patients, I would say if you want to sleep like a pro, pro, take prazosin. What drug helps performance anxiety? So they're going to give you in question stem somebody who is expected to give a speech or hasn't been doing speeches due to the fear of performance anxiety and has been inhibiting their work or life, and you're thinking about prescribing a medication which should be propranolol, beta blocker, that reduces tremor and tachycardia. And I would just say perform like a pro. Propranolol, perform like a pro. What drug causes severe sickness with alcohol? This will be disulfiram, anti-abuse, inhibits aldehyde dehydrogenase, and they're going to tell you patient is presenting really sick. He was drinking and he was taking different medications, and in combination with alcohol, which medication was likely the culprit, and this will be disulfiram. What helps maintain alcohol abstinence safely in liver disease? And that will be a camprosate. Acamprosate. Acamprosate. This is a funky word. Modulate glutamine. Memory hook, which thank God I just remember ACAMP. ACAMP helps you stay dry. So if I think about alcohol abstinence safely in the liver, and I would just say this patient needs to go to the camp to stay dry, and I would just look for ACAMP in the answers, and I would always get this question right. What blocks alcohol and opioid cravings? That will be naltrexone, opioid receptor antagonist. What medication treats opioid withdrawals? Methadone, buprenorphine, and clonidine. What is the methadone mechanism of action? Full opioid agonist used for maintenance therapy. What is the propion's mechanism of action? Partial opioid agonist, safer, lower abuse risk. What is the treatment for benzodiazepine dependence? Slower taper to avoid withdrawal seizures. So in a question stem, they can say the patient presented with a seizure and was taking all these different medications, and which one of the medication was likely the cause of their seizure, and that would be a fast taper of benzodiazepines. What non-stimulant treats ADHD? And that would be the atomoxetine, norepinephrine reuptake inhibitor. And I would just say ATOM in atomoxetine. ATOM aims at focus, not fun. ATOM aims at focus, not fun. This is a non-stimulant that treats ADHD. What ADHD meds have the highest abuse potential, and that would be the Adderall. It is release dopamine and norepinephrine. What ADHD medications are best for patients with substance abuse? And again, that would be atomoxetine or bupropion. Addiction, avoid Adderall. In the question stem, they're gonna present a patient with ADHD, but they're also gonna tell you they have substance abuse issues. And of the following medications, which will be the best fit for that patient, and that would be atomoxetine. Adam aims at focus, not fun. Which antipsychotic increases prolactin? And that would be the risperidone, causes galactorrhea and amenorrhea. Risperidone increases prolactin. What causes tardive dyskinesia? Chronic dopamine blockade, receptor supersensitivity. Too little dopamine for too long equals dancing face. Chronic dopamine blockade leads to tardive dyskinesia. Too little dopamine for too long equals dancing face. What treats tardive dyskinesia? Well, for dancing face, you're gonna need benazine, which is VMAT2 inhibitor, and Wall stops the moves, like VAL in a medication. I would just think like a wall, and it stops the moves. What is the major side effect of electroconvulsive therapy? Short-term memory loss. So they're going to tell you a patient was undergoing electroconvulsive therapy, presenting with all these different symptoms afterwards, and they're going to ask you which of the following symptoms is likely related to the electroconvulsive therapy, and a short-term memory loss will be your answer. What antidepressant aids in smoking cessation? That will be bupropion. What combo causes serotonin syndrome? SSRIs plus MAOIs or SSRIs plus triptan. So if they want to get really creative in the question stem, they're going to present somebody with the migraines who's taking triptans, but they were also prescribed SSRI for their depression, and now they present with serotonin syndrome, and they're going to ask you what is likely the cause. So you're going to look for SSRI plus triptan. And a final question, guys. What lab should be monitored with lithium therapy? When any patient takes lithium, we should be monitoring their TSH, creatinine, and lithium levels. Check the LIT levels, iodine and health. LIT levels, iodine, health. TSH, creatinine, lithium. Well, I hope you guys find these questions very helpful. I wish you best of luck on your exam. Do check out his book. Help you study smarter, not harder. Pass your exam. Rock it. Like I always say, thousands and thousands of students done this before me. So can I, period. So can you, period. Good luck, and I'll see you in the next exam.